I want to have everyone give a nice big welcome to Republican gubernatorial nominee Bill Bryant.
Well, thank you very much. I really do appreciate this opportunity to come and talk with you today and to share some ideas. What I would like to do in the next few minutes is share with you my healthcare priorities and also some of the ideas I have on how we can build a stronger, more integrated network of care for our community. Now, building a system of integrated care is going to require a governor who is capable of managing state government. That is, working with agencies to control healthcare costs and ensuring health programs are being run in a way that will meet people's needs. Building a system of integrated care is also going to require a governor who has the intellectual curiosity to understand the interconnectedness between primary care, mental health, education, and our society's safety net. What I'd like to do over the next few minutes is share with you my 5 healthcare-related areas that I want to focus on as your governor. And my objective is to integrate these 5 areas as a means of containing healthcare costs and as a means of providing healthcare to people both in our rural and in our urban communities. The first area that as governor, the first of 5 that I want to focus on is the management of our state health programs. Public agencies do not run on autopilot. Running a government takes work. Management of our state's Medicaid and health-related programs must be founded on engaged leadership and on data, not on lazy analysis and wishful thinking. And unfortunately, the current administration has made a mess of our state's health programs by relying almost exclusively on lazy analysis and wishful thinking. The best, or possibly the worst, however you want to look at it, example of this administration's incompetent management of our state's healthcare programs is the Healthcare Authority. The Healthcare Authority's hundreds of millions of dollars worth of cost calculation errors and cost overruns last year eviscerated the state's budget surplus. Before the $300 to $400 million error, cost calculating error, the legislature had actually questioned the governor's projections and as a result appropriated funds to bring in an outside actuarial to double check the assumptions and the calculations. And Governor Inslee vetoed those funds, providing for the outside actuarial, saying that they were not necessary. But within months, his office had to admit to a $463 million miscalculation. In another instance, his administration promised $111 million in savings from Healthier Washington, and it budgeted on saving $111 million. But when only $1.4 million of that $111 million were realized, he had to beg the legislature for $85 million to cover up the mistake. Audits have revealed that the Healthcare Authority has lost tens of millions in failing to secure Medicaid reimbursements. We might consider all of this something of a comedy of errors if the consequences weren't so significant. But incompetence has consequences. The failure to competently run our state's Medicaid and public benefits programs stresses our state's budget. And as a result, that puts pressure on our safety net programs, and it passes on higher costs to individuals who are trying to buy insurance. If we're going to contain medical costs for individuals and provide an integrated network of care, the competent management of the Healthcare Authority must be a priority for the next governor. The second area that I want to focus on, and this is an area where I really want a lot of your help and input, is on reducing wasteful health care. This is an issue that has come to my attention as a result of conversations I have had all across Washington state. And is what I've come to understand, and these are conversations with healthcare providers and doctors and hospital administrators and elected officials, but what I've come to understand in the management of our healthcare is that about 30%, and I understand there's a general consensus around this, that about 30% of our healthcare in this country is unnecessary. and that this is not a problem which is unique to Washington. And there might even be limited ways in which a governor or a state government can affect change. But if we're going to contain costs, we need to try, if only to launch pilot projects. What I understand from these multiple conversations we need to do is to develop or provide tools that allow for better decision-making by both providers and patients. And I've been assured that we are making progress in this area, but also told that if we're going to continue making progress in this area, what we truly need is reasonable, real-time, actionable information that is available to the provider and the patient. And that if the healthcare market is ever to resemble anything like a true market, then information that drives better decision-making has got to be available in real time. What I'm grappling with, and what I really want your input on, is threefold. First, too much information can be almost as much of an obstacle to efficient decision-making as too little information. So how much information do we need to be making available to providers and to patients in real time? And then second, what sort of information do we want to be making available? And who's going to decide that? And then third, what is the role of state government, or what could state government do to increase the transparency that would improve the quality of care that we're making available to Washingtonians? Minimizing unnecessary care is a critical component of cost containment, and I really welcome your ideas on what sort of pilot projects the state could be putting together to help get that done. As governor, the third area, healthcare-related area that I want to focus on is rural health. Providing quality care is a challenging issue in some of our rural communities in Washington State. I've talked to community leaders and to local elected officials in small towns, particularly over on the Pacific Coast and here in eastern Washington, where locally available regular health care doesn't always exist for everyone. In some of these communities, health care exists, but not for people who are reliant on Medicaid. And this requires some of the neediest people in our midst to travel the furthest to get the care they need. In many communities, even those communities that have sufficient primary care, mental health providers and drug addiction services simply do not exist. In too many of these situations, the primary care providers that are there in those rural communities, or even worse, law enforcement officials, must deal with the mentally ill or the drug addicted. To call that less than ideal is a vulgar understatement. The state of healthcare services in some of our rural communities needs gubernatorial leadership. And we must explore options to improve the delivery of care in rural areas, including, and these are some of the options that I want to explore, increasing the deployment of telemedicine, the expansion of medical residency slots in Eastern Washington to help the critical shortage of providers, and that is something that is already being addressed here in Spokane, and then also alternative certification for returning veterans with medical and mental health treatment experience. The fourth area kind of emerges from this whole discussion of the needs of rural communities, where we're talking about the primary and the mental health needs in rural communities. And the fourth area is really trying to address how we integrate both our primary and mental health services. And again, this is based on a lot of conversations I have had throughout the course of this campaign all across Washington State, with county commissioners, hospital administrators, doctors, mental health professionals, homeless advocates. There's a consistent theme, and that is to truly contain healthcare costs at the state level, they will tell me, we've got to better integrate primary and mental health care services. With costs rising beyond the capacity of some people to pay, with rising homeless populations, and with increasing mental health needs, far too often, emergency rooms and jails are serving as primary and mental health clinics. One hospital administrator was actually on this side of the pass, told me, and of course he was just doing this off the top of his head, but he said, Bill, if I could eliminate all of the emergency room visits, he said, I think we could cut our overall cost by 17 to 20%. He says, as an example, somebody will come into an emergency room and they'll have some sort of an infection. And the doctor will treat that infection at huge cost because it's not an emergency situation. But the doctor will be looking at this primary care issue of an infection and realize that there are underlying medical or mental issues as well. And he says what's going to end up happening is that doctor is going to give that patient a prescription for the infection, which might not get taken as prescribed. And then that doctor is also going to give that patient an appointment slip to go across town in 30 to 40 days for a mental health evaluation, which is an appointment that's not going to get made or met. And what we need to be doing instead, I'm repeatedly hearing from all sorts of people in different areas of the healthcare community, is that we need to have the capacity to provide in-the-moment mental health services alongside primary care in a non-emergency room environment. And in conversations with doctors all across the state, it's clear that this is essential if we're going to contain costs. Because what I am being told that we have a situation where a disproportionate amount of our healthcare costs are being driven by a very small percentage of our population, and that among those patients, mental health is an issue, and that we cannot just treat the primary, but in the same moment we must be providing mental health services. Integrating primary and mental health and drug addiction services in a non-emergency room setting and providing local law enforcement with options to jailing the mentally ill must be a priority for our next governor. Now, fortunately, I've learned that we have a lot of programs that are beginning to do this. I've heard about programs and heard ideas in communities all across our state, from Wenatchee to the Tri-Cities to Southwest Washington and Vancouver. There are programs that are integrating primary care and mental health care in non-emergency room settings. And identifying which of these programs can be scaled up on a regional or a state basis is critical to containing Medicaid costs. The fifth area that I want to focus on is not my fifth priority. It is an issue that will demand my immediate attention during the transition, and that is Western State Hospital. Washington State is ranked 50th in providing mental health care to adults, 47th overall. Let that sink in. We're ranked 50th. We're better than that. The lack of management at Western State Hospital epitomizes Governor Inslee's incompetence. Western State Hospital failed 4 federal audits, and the governor did nothing. It wasn't until felonious, dangerous patients escaped that he came to life. And then he withdrew Western State's federal accreditation before it could be revoked, but he told no one. He covered it up. Western State Hospital management didn't know that they had lost their federal accreditation, and they continued to recruit new staff promoting Western State Hospital as a fully accredited institution when it was not. The website continued to identify Western State Hospital as accredited when it was not. In our debate here in Spokane on August 17th, the governor and I talked about the state of Western State Hospital, and the governor never once mentioned that it had lost its accreditation. Its federal certification is now hanging in peril. It is a failed institution and at risk of losing millions of dollars in federal funds. Now, Western State Hospital is the backbone of our mental health system. And while a well-functioning hospital at Western State doesn't necessarily provide for a well-functioning mental hospital in our city streets and in every community around Washington State, the withdrawal of federal funds from Western State would have serious ramifications on our ability to handle and serve some of the most dangerous and most vulnerable in our midst. And the state, assuming the hospital's operating and treatment costs, would have ramifications throughout our state's healthcare budgets. Incompetence has consequences. So what needs to happen? The next governor needs to embrace the bipartisan reforms that Governor Inslee vetoed. Those reforms would not only have set Western State Hospital on the path to recovery, but it would have begun a shift towards more community-based care all across Washington State. Second, 2 consulting groups have completed assessment reports of Western State Hospital. Governor Inslee, today, needs to release those reports to hospital staff and to the legislators. They can't help fix the problems until they understand them. And third, the governor needs to immediately disclose the number of on-call staff at Western State Hospital is relying upon, and also the amount of overtime that is being billed. The amount of money spent in recent years on administrative staff versus patient care staff also needs to be disclosed. Developing an understanding of how much additional staff is needed cannot be done until there is a clear understanding of how much is currently being spent on personnel. These three steps will better clarify what reforms are needed and how much they're going to cost. It is an issue that demands our immediate attention. And that is why I've asked Governor Inslee to join me in a debate focused solely on our mental health system and on homelessness. These 5 areas, the management of our state programs, the reduction of wasteful health care, the focus on providing rural health care, the integration of primary and mental health, and reforming Western State Hospital are the 5 health care priorities I will bring to the governor's office. Woven together, these 5 provide a holistic approach to cost containment and to delivering better services. But there is one more area I want to discuss before we wrap it up here. I want to leave you with one final way the state can reduce health care costs and improve health for Washingtonians, and that is education. Remember when I stated that Washington State is ranked 50th among the states for providing mental health care to adults? That abysmal ranking was not entirely due to the shambles, the broken state of our mental health care system in Washington State and at Western State Hospital. Big negatives in those ratings were also Washington's high homeless population and our high school dropout rate. We live in a state with escalating homelessness. In King County alone, homelessness has increased by 41%. But it is an issue I have dealt with all across Washington State. I've visited shelters in Wenatchee. I've talked to business owners in Walla Walla. I've talked to community leaders in Vancouver and in Longview and in Puyallup and in Auburn and in Federal Way. All across Washington State, cities are grappling with the rising homelessness. And we live in a state where 20 to 25% of our 9th graders will not graduate from high school. Those who drop out of high school are much more likely to experience poverty and health problems. The likelihood of them being homeless increases, and following homelessness can come mental illness and primary care needs, drug addictions, and far too often incarceration. To put it bluntly, we can spend money treating preventable chronic diseases, treating healthcare problems resulting from lifestyle rather than disease. We can spend money building detox centers and methadone clinics and emergency housing shelters. Or we can keep kids in high school. I want to keep kids in school. I want to keep kids in high school and help them graduate from high school with the skills and knowledge they need to be successful in life. Primary and mental health care, homelessness, and education should be considered as pieces of an integrated plan that will provide Washingtonians with affordable care that meets their individual needs. And these all need to be brought together and considered part of an integrated plan that will provide a safety net of services for people in both our rural and in our urban communities. And ladies and gentlemen, I really do welcome your partnership in helping develop that plan. Thank you.
Well, thanks, Bill. That was good. As EJ said, I'm Eric Erling. I'm part of the State of Reform team. Some of you might recognize me from my past life at Primera Blue Cross. And so really thrilled to be with the State of Reform team and to have Bill here and have a good conversation. There's a couple things that really jumped out at me from your remarks, Bill. First, I want to unpack a little bit. You've got some pretty clear critiques of current administration, a couple key agencies, whether we're talking about the HCA, whether we're talking about Western State. We could probably sit here all day and go policy wonk geek and pick apart details, but I'm curious, governor's supposed to lead, and you talked about that. what kind of leaders would we be talking about in a Bryant administration? Part of the reason I ask that is, obviously, Republicans haven't had the governor's office for a wee bit of time. So there's not a lot of Republican appointees in Olympia today. I think it would be helpful to understand, what does an appointee in a Bryant administration look like?
Well, they're competent. And they actually have background in the field that they will be working in, and that they will have the administrative skills to work with the public employees who are there and to nurture and mentor them so we can actually bring people up. One criticism that I hear an awful lot from public employees in Olympia, who always want to meet with me in a very dark place a long ways from downtown, is that there's a whole layer of administration that didn't exist under Governor Gregoire or previous administrations, and that these are not necessarily professional positions, that they've been filled by more political appointees, and that's inhibiting them from getting their job done. And that it's putting a ceiling over them to be able to rise into more managerial and executive positions, and that's wrong. You need to bring in a leader who can actually cultivate the people who are there and who are trying to do a good job and to serve people. I come from the private sector. I've built a company over the last 24 years, and I think fundamentally what a CEO or a governor, a chief executive needs to do is first articulate a vision for each agency, each department, or Western State Hospital, or for DSHS, or the healthcare authority. Articulate a vision of where you want that agency to be in 4, 7, and 10 years. And make it very clear how that looks different than how it exists right now. And then you need to go out and find people who have experience in that field. I don't care if they're Republicans or Democrats. This isn't, for me, really running the state government is not about Republicans or Democrats. It's about competence and getting it done well. So go out and find people who know how to do that job, and then listen to their ideas on how they can fulfill your vision. Because if they're really good, they're probably going to have their own ideas, and empower them to go forward with their own ideas, but then hold them accountable. And that's what we've been missing in this administration. We have not appointed, we have no vision on where we want these things to be in 5, 7, and 10 years, so they're on audit pilot. And then we don't have people who are really qualified and have backgrounds in those fields. And then they're not held accountable when they fail. I mean, how can you make 3 mistakes that add up to over $500 million and still keep your job? It's unfathomable to me.
So let's build on that. Another thing I was struck by was the scope of healthcare agenda you're talking about. So for example, items like integrating behavioral health with primary care. That's a big lift. It's going to require a lot of energy, a lot of attention, whether it's directly from a Governor Bill Bryant or other members of a Bryant administration. Give us a sense for how would healthcare rank with other key issues for a Bryant agenda as governor?
Oh, that's a great question. Because if you think about what's going to be on the governor's desk in January 2017, regardless of whether I'm walking into that office or Governor Inslee's walking into that office, there are going to be 6 issues that are on that desk. On the very top of the stack is McCleary, and how do we come up with a plan to equitably fund education in Washington State. The second issue is going to be traffic and transportation, and how do we turn the Department of Transportation around? How do we deal with the 4th worst traffic in the United States? The third, at least it's on my list, I don't think it's on the governor's list, but the third is what do we do with unemployment? Something the governor doesn't mention is that we have one of the highest unemployment rates in America. We have the 8th highest unemployment. We're right up there with West Virginia and Mississippi. You don't know it if you live between Bainbridge Island and Bellevue, but just go north of here and the unemployment rate's about 10%. Go down to Lewis County, where I was born, it's 8.5%, 9%. Where my wife was born in Cowlitz and Wahkiakum County, it's probably 8.5% to 9.5%. In rural communities across Washington State, unemployment is an issue, and we've got to deal with it. So you've got McCleary, you've got transportation, you've got unemployment. You're going to have to deal with DSHS, which is in shambles, the Department of Corrections, which is a mess, and then we have moved backwards by every environmental measure but one on salmon recovery in the last 4 years. And we've got to move quickly or it's going to be too late. Those are immediate issues. But so where does healthcare fit in?
Yeah.
And if I'm looking at issues that a governor needs to begin thinking about right now that are going to affect us in 4 years, not right now, there are 2. One, rising Medicaid costs. And the second, is an alternative to the gas tax, which you don't have to have in 4 years, but we're going to have within 8. So a governor should be thinking, okay, what are the issues that are going to hit us 8 to 10 years out? Medicaid costs need to be contained now, or it's going to become a bigger problem, and then we got to start thinking about how we replace the gas tax. If we wait for 4 to 8 years to get ahead of some of our Medicaid costs, the bow wave will be so huge it will overtake part of our budget. So while I've got these 6 immediate issues on the table, I have got to make healthcare costs and cost containment a priority in the first 4 years.
So speaking of healthcare cost containment, I think you go to any number of sessions here at a state of reform event and you get a pretty clear picture. Oh, the state needs to negotiate with the feds quite a bit in order to do the things it wants to do. So if we're talking about containing Medicaid costs, that's obviously a discussion with the federal government. So how would a Bryant administration plan on working with a Trump administration versus a Clinton administration?
Does anybody know what a Trump or a Clinton administration looks like when it comes to Medicaid administration? I mean, it's not as if it's been a subject of debate or discussion in this election.
Not much policy has.
No, this campaign has been something between different and bizarre. Who knows how either a Trump or a Clinton administration would handle Medicaid costs. And it does require a lot of federal negotiation with the state. But what I'm hearing, what I tried to point out in my comments, is that there are things that we can be doing within the state to contain those costs. And that's the integration of behavioral mental health and primary care. It is ensuring that we deal with a escalating, or at least too high, high school dropout rate. That we can ensure that we are providing mental health and primary care in our rural communities. And that if we don't deal with some of those, then the costs are going to continue to rise. So there are things we can do in addition to negotiating with the federal government.
Okay. Building on that then, so that gives a window into how you handle one aspect of relationship duties as governor. How would a Governor Bryant work with the legislature?
Oh, really well. Again, I think that's because I'm not particularly partisan. I like to just get stuff done. And I like to identify what the priorities are and then build a coalition behind those priorities. I mean, that's what I've done in my entire career. My job, I worked in the Apple industry in the 80s, opening up export markets, and then I've been doing this for other clients around the United States. I have to go to a foreign government that's not allowing our U.S. export in, and I've got to meet, it's usually an agricultural product, so I've got to meet with the Ministry of Foreign Affairs and the Ministry of Agriculture and the Ministry of Trade and figure out why they're not letting our product in. And then I got to figure out, when they tell me, you know, okay, this is what's going to be required, I got to come back to the industry, and they're not going to want to do what the foreign government wants them to do. And then I go to U.S. government, to the U.S. Department of Agriculture, and to the U.S. Trade Representative, and make sure they're comfortable with what we're negotiating with the foreign government. It's three-dimensional chess. And the only way that you can actually get to an agreement is to build a coalition of members in the foreign government, the U.S. industry, and the U.S. government, and make sure they all benefit, possibly in different ways and for different reasons, but they all benefit from getting to an identified endpoint. And so when the negotiations get tough, people don't walk away because they have something in it, and you've helped them figure out what they're going to get out of it. That's exactly the kind of leadership we need to have in Olympia right now. It's exactly the kind of leadership we do not have. If you identify strategic goals that are 4, 7, 10 years out, and you go work with the legislators and help them understand how they can benefit from achieving those goals, then it's a matter of just building a coalition behind those objectives. And that's what I've done my whole life, and it's what I will do in the governor's office.
So one thing I thought was maybe not necessarily missing, but a notable absence in your remarks is, okay, the year's 2016, stereotypical Republican running for office, they're going to rip on the ACA. And there weren't, you laid out a pretty broad healthcare agenda, but I don't think the words Affordable Care Act or anything like it came up. One point of curiosity I have, a number of members of the legislature have grumbled at times about the health benefit exchange, the structure, how it gets funded. Do you have a position on keep the health benefit exchange as it is? Do you want to see it reformed? What do you think? Well,
and I don't need to be telling you this, you guys all know this much better than I, but there are exchanges around the United States which are suffering or going bankrupt. Among them, Washington State is one of the better operating ones. I'm not in there to slash and burn and go after it. I want to make sure that we're providing health care to the people of Washington State that meets their individual needs at a reasonable cost. And however we get there, I'm open to whatever options exist.
Okay. I'm going to give an opportunity in a little bit for the audience to ask questions as well, and I think we'll have a couple mics that will be available. So when we get to that part, we're definitely going to want to have you raise your hand, have a mic brought to you, and go from there. But before we get into that audience Q&A, one thing I'd definitely like to dig a little deeper into is something you were talking about, Bill, that I think is atypical, again, from what I often hear from Republicans talking about healthcare, especially on an election stump. You're talking a lot about social determinants of health. Homelessness, graduation rates. How did you get there? Give us a window into how does Bill Bryant get to a place where when he's talking about healthcare, he's focused on homelessness, high school graduation, opiate abuse?
Well, part of it is, although the minor part of it is the experience in just being a candidate. And if you're a candidate for governor for 18 months, you're going to have the opportunity to meet a lot of different people from different walks of life in different communities. And when you begin hearing the same themes coming from these very different people, you know that there's something there. And whether I'm talking to law enforcement officials, or I'm talking to homeless advocates, or I'm talking to hospital administrators, the underlying social causes of a lot of our problems continue to come up. I think maybe I was more attuned to hear that because of my own personal background. I began working with homelessness over 10 years ago, long before I ever ran for office. I first ran for office in 2007 in King County. Between 2004 and 2006, though, I was a volunteer night manager at a homeless shelter for men in Seattle. And so once or twice a month during the winter, I'd go in and manage the shelter overnight. And I learned a great deal about homelessness in those 2 years. And it's an issue that even though I no longer volunteer regularly at the shelter or at all, it's still it's a very personal and passionate issue of mine, and I want to carry that passion into the governor's office and deal with it. And I've been talking about homelessness in this campaign for the last 18 months. Education reform is another passion of mine. I grew up in Hoodsport over in the Olympic Peninsula. I don't know if anyone knows where Hoodsport is, but it's a small school district over in the Olympic Peninsula at the base of the Olympic Mountains on the Skokomish Reservation. And I got a good education. And it was a time when we funded basic education equitably across our state. But today, we don't. And the quality of education you get in Washington State too often depends upon your zip code or your school district. If you live in a wealthy school district where you can pass levies and parents can have fundraisers, your kids are going to have access to great programs. But in too many neighborhoods that are economically disadvantaged or are rural, you're not going to have access to those same programs. And that's not only unconstitutional, it's morally wrong. And we're leaving too many kids behind. To think that we live in a state where 20 to 25% of our ninth graders will not graduate from high school, I just think should elicit outrage. And instead, we just accept it. I mean, this isn't just this year. It's been going on year after year that we have this high school dropout rate. I mean, how many of you would buy a ticket on an airline where you knew that 20 to 25% of their planes crashed? But we will put our kids into a system that we know, put our kids year after year into a system that we know is going to fail 20 to 25% of them. We have this post-World War II education system where essentially it's based on the industrial model, where you get on the conveyor belt at kindergarten and you move through based on your age, and when it gets to be the 12th grade, you jump off the conveyor belt and go do something else. It worked for many, and it still continues to work for many, but it's failing far too many. And one of the things that I want to do in introducing innovation into our high schools and our school system is to reinvent the last 2 years so that it's relevant to kids who don't want to go on to college. Because too many of those 20 to 25% who are not ninth graders, who are not graduating, the problem is that we're getting them into the ninth grade and they're probably reading at a 7th or 8th grade level, and we tell them, we got to get you college ready. And I'm like, well, I don't want to go to college. So if this is all about hanging out in high school for 4 years to go to college, why am I hanging out for 4 years? And unless they're interested in sports, we're at risk of losing them in their junior, senior, sophomore, junior year. So let's reinvent the last 2 years of high school so that if you want to go to university, great. We'll have a Core 24 program and we'll get you ready for university. You want to go to community college? Fine. Let's have Running Start available to kids all across Washington State. But if you don't want to go to community college and you don't want to go to university, that should be okay. And let's have pre-apprenticeship programs and industry certification programs in the junior and senior year so that kids who don't want to go to university can get not only a high school diploma, but a certificate that allows them to get a family wage job after they graduate. And if we keep those kids in school, their likelihood of living in poverty or having mental health or having severe chronic and primary care needs later drastically drops. So it's not only the right thing to do to encourage kids to go on and get their degree so we have a workforce that we need to have a strong economy. Eric, it's also an underlying root of how we're going to keep our Medicaid costs contained.
Okay. So with that, we've heard a pretty broad-ranging talk and Q&A with a gubernatorial candidate. What questions would you like to ask? Please do raise your hand so we can get you a mic so the rest of the audience can hear your question.
Somebody's passing out fundraising envelopes, right?
I've got one while someone summons up the courage to raise their hand. Bill, you alluded to a pretty pragmatic approach, I think, or what I'll characterize as a pragmatic approach to the health benefit exchange. Is your expectation, if elected, that the Affordable Care Act is settled law? Or is it your expectation that it's open for repeal?
Well, does anybody think it's open for repeal, or if it would have to be replaced with something else? It's not something I'm going to go after and target. We have a lot of other issues in the state. I'm not going to be leading that charge. I don't know. I think it would depend entirely on the makeup of the next Congress and whoever occupies the White House. And if anybody thinks they can guess that right now, I'd love to meet you afterwards because I've got a few questions for you too.
Okay, fair enough. Questions from the audience? I've got one over there.
Over there.
I hadn't, can you hear me all right?
Yep.
I hadn't thought about this until you brought it up, but in addition to focusing on schools and education from a funding standpoint, as well as a reform from a curriculum perhaps standpoint, you had mentioned addressing the unemployment rate for the rural areas. Can you speak to how you might do that?
Sure. And yesterday, for your viewing pleasure, I rolled out a jobs and economy speech. We are very blessed in Washington State to have a very diversified economy. When you think about what generates jobs in Washington State, we really have 10 different job-generating sectors. We have trade and transportation. We have tourism and recreation. We have technology. We have medical science, medical research, global health. We have the military. We have manufacturing. We have agriculture. We have forestry. We have fisheries. And we have energy. We have all 10. There are a lot of states that would love to have 3 or 4 of those. Arkansas, Arizona, New Mexico. We have all 10. But what we don't have in this state, and again, this is probably betraying my private sector perspective, but what we don't have is a strategic plan on how we can harness the regulatory power of the state and the budget of the state and use it in a way that can help the private sector generate jobs in all 10 of those sectors. If you don't have a plan of where you would like those 10 sectors to be, and if you haven't figured out how, for example, we can use tourism and recreation to generate jobs in some of our rural communities, or what could we be doing to move manufacturing out of the urban core and into some of these communities? If you're not thinking about where we want these communities to look like and where we want these sectors to be in terms of employment in 10 years, then you're not figuring out how this next biennial budget will help you get there. In the absence of a strategic plan, a biennial budget just becomes a political document that whatever you need to get 50 votes out of the House and 25 out of the Senate and that this governor you're willing to sign so the legislature will go home. But that's not what we should be doing. A budget should be a building block toward where you want to end up in 10 years. And if we had ideas and had strategic objectives for how we wanted to use, for example, tourism and recreation to generate jobs in some of our rural communities, we could be figuring out right now what we need to be doing with the tourism budget to begin moving us towards that objective. If you want to talk about how we want to have agriculture be even more of a critical component of our economy in 10 years and have agricultural exports even a larger employer in a lot of our rural communities, then in this next biennial budget, and certainly in the 2019-2020 biennial budget, we need to be figuring out how much of our capital budget we're going to dedicate to water retention in Central Washington. Because our communities are continuing to grow, and our agricultural exports and production are continuing to grow. And unless we expand our water retention capacity, we're not going to have the water we need to accommodate the growth in 10 years. And we can't wait for 10 years to build those facilities. But if you're not thinking 10 years out, and you're playing whack-a-mole with your budget, just dealing whatever the political problem is, we're going to find out that 10 years from now, we're going to still have the rural unemployment that we've got. Again, I don't see this as a Republican or Democrat deal. It's just about making government work better. It's about strategic vision. It's about competence.
Other questions for Bill Bryant? I've got one right here.
You touched on factors that contribute to health: housing, food, shelter, access to education, employment. To really build all of those things is probably going to take more resource than is currently invested in all of those areas. Where do you see those resources coming from, given what is arguably the most regressive tax system in the nation that doesn't seem prepared to provide more, at least, tax dollar?
But well, there's two issues there. Is that the tax system is regressive, or that it's not generating enough? Because it's generating a lot, it's just doing it in maybe a regressive way. So is the issue the amount that we're generating or how we generate it? It's the amount, right? Where are we going to come up with the money? This is not a cop-out, and it sounds really wonky, so it's probably not a good answer. But it's both. I mean, it's not a cop-out, but it does sound wonky. One of the things I've said that I want to do on day one is announce a 4-year initiative, and I wanted to do it in 1 year, and I've been told, working with some prior and current legislators, I can't do it in 1 year. But I want to launch a 4-year initiative to entirely zero-base the budget. We have not seriously looked at this budget in decades. Gary Locke was probably the last to really seriously look at it and critically. And what we need to do is identify strategic objectives for every department, dealing with some of the issues that you identified. Where do we want them to be in 10 years? Where do we want them to be in the next biennium? And then let's look at every program, every agency, and every tax incentive in those departments and figure out whether they are moving us towards those strategic objectives. Let's then rebuild the budget from zero up, funding only those projects and agencies that are actually moving us towards those strategic objectives. That wholesale reevaluation of our budget is long overdue. And this now, it does sound like a stereotypical Republican cop-out, but it's not how I mean it. Until we understand exactly how we're spending our money, I don't think we can go to the taxpayers and ask for more. And this is particularly true in an issue with homelessness. We have doubled under the Inslee administration the amount of money we are spending on homelessness. And whenever I challenge the governor on the record on homelessness, he will trot out a whole list of programs and how much more he's spending. I'm saying that's not the point. You're spending twice. It's actually an indictment. The fact that you're spending twice as much and it's continuing to go up actually indicates we're not doing the right things. And so what I want to do is I want us to figure out exactly which programs are working and which are not. Let's have quantifiable measures for what defines success of every program, and let's put our resources into those programs that are working and defunding those that are not. What will happen as soon as you defund a program, to stick with our example of homelessness, people are going to start screaming, oh, you're cutting services to the homeless. Well, if it's a program that's not working, you're not cutting services to anybody. And actually continuing to fund it is hurting the homeless. You need to be funding programs that work. And right now, and when you look at DSHS, when you look at education, when you look at corrections, when you even look at Department of Ecology, there aren't quantifiable metrics to even identify, in some cases, whether the program's working or not. So we're not in a position to say we need more. I mean, we need to figure out exactly how we're spending our money. And that exercise has got to occur before we go out to the people and ask for more.
Other questions for Bill? I've got one more I'm going to broach. This morning we heard from Peter Adler with Molina and was talking about some of the success they've had as a plan that's traditionally been in the Medicaid space, but working with an exchange population, in part by managing that population pretty tightly. I was at a session this morning talking about the sustainability of the individual market, and one of the speakers was talking about the trend away from broader networks to tighter HMO or exclusive provider organization networks. And then, Bill, as you talk about whether you're talking about 30% of the healthcare system is waste or whatever the citation is, lots of experts out there saying, well, not all this care makes sense. That usually involves best practices that identify treatment A is the right course of action, but treatment B is not. All of those things ultimately involve saying no to the consumer in a way, at some point. Are you prepared for state government to say more frequently for the people it pays for healthcare for, whether it's Medicaid, state employees, others, to say, no, that option isn't available because it isn't the most cost-effective approach?
And would we be saying no because we're just trying to contain costs and at the same time then we're curtailing care? Or are we saying no because it's not essential to the care they really need?
Well, in theory, if the experts are talking about waste, it's more of the latter than the former.
So then you have to make the case that we're saying no, not because we're trying to just cut costs and we're going to cut your benefits, but we're saying no because actually we're trying to develop a plan that's sustainable so you'll continue to have this health care into the future. But that's where leadership comes into play.
It's a compelling case to have to make. Last call for questions for Bill. All right, so we've had a great session with Bill Bryant. We've got another session coming up with Governor Jay Inslee at 3:45 today, which is a testament to the state of reform bringing people together like this. So let's join me in thanking Bill.